Substance use disorder is one of the most stigmatized mental health conditions. Research has proven that over and over again. We think that people are not like us, that they are weak-willed or somehow different than the rest of us.
We've treated substance use as a moral failing. We've treated it as something that should be shamed. People lock it and keep it behind closed doors, and that doesn't work. If we haven't figured out that doesn't work by now, I don't know that we're going to figure it out.
I was introduced to opiates. I had a back issue and was given a prescription at the doctor's, and the prescriptions increased as my pain increased, and from there, it took hold of me.
I began drinking when I was 13, along with about 10 other classmates in a slumber party environment in Preston Forest, and 3 of us grew up to not be able to stop on our own, and I was one of them.
I distinctly remember at the end of every night, I'd be like, man, when I get up in the morning, I'm gonna do something different. As you're laying there in bed and your brain's racing and racing, it's like, how did I end up like this? Every day was like, when I wake up in the morning, I'm not gonna get high, I'm gonna do something different than what I did today. And the madness of the morning kicks in as soon as my eyes open. And I immediately forget that at 3 o'clock last night I was saying, this is gonna change. And I immediately am dope sick and doing the skeezy stuff that I had to do the day before to get right that day. And it's just, every day is the exact same.
My name is Angela Hegeman. I serve as the Operations Director for the ETSU Addiction Science Center. I've worked in that role for about 9 years now.
So my name is Chad Duncan. I am Division Director for Outpatient Addiction Services for Frontier Health. So I'm over intensive outpatient services at all of our Tennessee sites, as well as our medication-assisted treatment programs.
We've had 40 years of year-on-year increases in overdose deaths in our country for 40 years. And in the past year, it has gone up from 2019 to 2020, that first year of COVID. Increases in overdose deaths were 29% in the nation and 40% in our region. I think explaining the neurobiology of substance use disorder is a little tricky when you're talking about which receptors certain drugs bind to. I think maybe it's a little easier to talk about it from a chronic disease model. So many folks in our area suffer from diabetes. It is a health-related disease mostly. So if folks just apply a good diet and do exercise and all of that, they'll be able to maintain their diabetes. So understanding it from that chronic disease model and that behavior change is very hard. How many of us can stick to a diet? How many of us can do exercise every single day? But we have this expectation that substance use disorder as a chronic disease, well, they should just be able to stop cold turkey and get better and stay away from it forever. So I think understanding that it's just like many other chronic diseases, and it is about behavior change, which is very difficult for all of us. And if we understand it from that perspective, I think that's maybe easier than understanding the full neurobiology. But there are certainly brain scans that can show you how sort of hijacked your brain is once you lose control. And that drug of choice, you have serious physical withdrawal, and you're no longer able to sort of use the frontal lobe in your brain to make these good decisions anymore, because your primal instincts to obtain that drug to keep from being sick are just so strong.
So the main thing we're looking for is to try to catch people and get them where they're at and work with them, kind of meet them where they are, and advance the recovery and try to get them to the point where they're in a maintenance stage where they've attained the recovery they want and they're maintaining it for a long period. The biggest barriers we see are access to services, access to transportation, access to safe housing, things like that. So those are the 3 biggest. If I was gonna, access is number 1, stigma is number 2, but they're pretty close together.
8 years ago, if you wanted to get treatment, it was pretty hard to find, or harder to find. Paying for it with your insurance might be even harder, but now there are so many resources available. I think either people being educated about what's available and what treatment is best for them, and that it might take several tries. First time doesn't always work, and really understanding that disease model. But I do think stigma, self-stigma, institutional stigma, I do think that is the greatest barrier and what we have to tackle.
The biggest thing first is to get client engagement. So the person has to be able to join with the treatment team and be able to trust us, or, and for people who have gone through a lot of, because with substance use, most people have experienced trauma, not, plus other, mental health things may be going on. So trust is a big deal. And there's a lot of fear. There's a lot of fear in asking for help. There's a lot of fear about what the help might look like and things like that. So, it takes a lot of courage just to ask. It's hard to come out and say, I have a problem. So the first thing is kind of developing the rapport, developing the clinical relationship, and developing that trust. And then, as we do that, we assess a person and kind of see where they're at and like, where do we need to start, and try to meet them there. And we really try to look at the person, internally, what's going on in their environment. So we look at, not just the substance use disorder, and also like what's going on medically, what's going on, what's their housing look like, what's their transportation situation, do they have any income, are they safe when they leave here, where are they sleeping, is it safe, can they have a meal, So we try to, we have wraparound services, case management, peer recovery specialists that work with people, and they really look at, they might have a roof over their head, but it's not a safe place for recovery.
275 people every day in the United States die from a drug overdose. And in our state alone, over 3,000 people died just last year. Sullivan County is a hot spot. On a heat map, it does show that. I always hesitate to say that East Tennessee is a hot spot because I don't want to paint our community in a negative light. Our community is wonderful and strong and resilient. And I think when we begin to see people in recovery as wonderful and strong and resilient, we're going to, turn the corner.
One thing I would really like for people to know is that, do not let the cost of treatment or fear of the cost of treatment keep you from getting treatment. The grants that are available, if people are uninsured or even if they're underinsured, like a lot of insurances don't acknowledge substance use at the level they probably should, and so they're not covered as well. So if a person is also considered underinsured, they may be eligible for the grants.
So I think it's important to think of healthy communities and what we can do to create healthy communities so that folks don't end up going down the trajectory and acquiring a substance use disorder. So making a thriving, economically vibrant, healthy community where young people have what they need, and that we address trauma, and that we support parents, and that we address poverty. All of those things create communities where people do not get substance use disorder, or they get it on a much smaller scale. And also paying attention to access and making sure that young people are not having regular access to substances, whether it be in their own homes, stealing alcohol from their parents, or that we, because of legalization of marijuana, we start thinking that marijuana is safe, and that 13 and 14-year-olds think that it's medicine and that it's okay. And so paying attention to all of those factors and creating healthy communities keeps us from the situation that we're in, where 275 people a day are dying.
This is a community problem, and the community has to own it. The community has to recognize it. They have to educate themselves. We really need to understand better about what substance use disorder is and how it affects people, so that we can respond better to it. We have to understand the problem. We have to understand how big that problem is, which is huge, and then we have to be willing to step outside of our comfort zone and find a new way of looking at things to make it to where it is a safe environment for people to reach out and ask for help.